Well, every woman has a story about gender bias in the health system. And for too long, women and girls have faced barriers to accessing appropriate healthcare. From being told that your pain during an IUD insertion isn't that bad, to waiting years for a diagnosis with endometriosis, paying hundreds of dollars a year for your chosen contraception, and not being able to access hormone replacement therapy. And that's why Labor is delivering an historic boost of over $500 million to women's health, which will deliver more choice, lower costs and better healthcare for millions of Australian women and tens of thousands of women in Newcastle. And this package is a result of a chorus of voices from across Australia. Women have been telling us that they have needed more from the health and medical system. This is not a new story, but finally, we have a government that is listening. The response to this $500 million package of women's health measures has been literally overwhelming, not only from the peak medical bodies, the RACGP, the AMA and all of the nursing colleges, as well as all of the health professional bodies. They've all praised this package as an absolute game changer. But it's not just the health professionals that recognise this, it's women. We have been hearing from the women of Australia. They have been rejoicing that finally someone is listening to them about their pelvic pain, about their menopause symptoms, about their experiences with contraception. Someone is listening to their concerns that to be a woman in Australia means we have paid thousands of dollars more over our lifetimes on our health. Well, the Albanese Labor government certainly is listening, and we're doing all of this, of course, because we are Australia's first majority women government. When you have a majority women government, the conversation changes. We can see it not only in women's health, but in the legislation, in every piece of legislation we have created. Australia's first legislation in wages increases for female-dominated industries like aged care, like early childhood education, access to paid parental leave, ensuring we pay superannuation on that paid parental leave, women's safety investments, supporting women's supports, securing more safe housing for women. A majority women government means that every single piece of legislation has a gender lens run over it. And we don't have those ridiculous conversations anymore in our party room about trying to establish the value in ensuring equity in Australia. In all of those areas, we've got fantastic female ministers, of course, as well as the fabulous women MPs and senators in the caucus room advocating consistently for policies that make sure women get a fair crack and at opportunity in this country. The Women's Health Package is part of a much broader agenda from the Albanese Labor government. It's making sure that women get a fair opportunity and get treated equally in Australia. And we've made big steps in the last 2 years, but there is, of course, always more to do. We know that women face dual gender biases in healthcare and society. We face the almost sole responsibility of family planning in this nation, physically and financially. And that's why we've introduced this package to take unfair financial pressure off women and provide them with more choice. So after more than 30 years, we finally have a new contraceptive pill that has been listed on the Pharmaceutical Benefit Scheme. I have to say, I'm sure this is a shock to Australian men, but women have been more than patient about this. And I think patience has absolutely run out. 30 years is more than enough time to finally get some new generation contraception onto the PBS. So it's great that's going to happen. Currently, 1 in 3 women aged 18 to 39 who use the combined oral contraceptive pill are paying for a non-PBS listed pill, which costs them hundreds of dollars more each and every year. From March 1, so in just a couple of weeks' time, some of the most commonly used contraceptive pills, like Yaz and Yasmin, will be listed on the PBS after the Minister for Health and Aged Care asked the Pharmaceutical Benefits Advisory Committee to finally put some deep thinking into how we might extend PBS benefits to this newer generation of oral contraceptives and the menopause hormone therapies as well. The listing of these pills is expected to benefit around 50,000 women each year who would otherwise have paid $380 a year and will now pay $126.40 a year, or just $30 a year if you're on a concession card. Work is underway to progress the listing of other contraceptive pills, so stay tuned. But Australian women have got some of the lowest uptake of long-term contraceptives like IUDs, and only 1 in 10 Australian women use a long-term contraceptive, compared to 1 in 8 women just in our closest neighbours in New Zealand, 1 in 7 in Ireland and 1 in 3 in Sweden. So we've got some work to do there. The government will be boosting Medicare payments to doctors and nurse practitioners to provide bulk bill insertion and removal of IUDs and implants, and Medicare rebates will increase by up to 150%, with around 300,000 women each year expected to save up to $400 in out-of-pocket costs. IUDs and birth control implants provide health benefits that extend way beyond contraception, and I think that's kind of important to note, including the management of really heavy menstrual bleeding, painful periods, endometriosis, as well as perimenopause and menopause. We've known they're not for everyone, but every woman should absolutely have the choice and be able to access them if she chooses. An investment of $25.1 million will establish 8 centres of training of excellence to ensure healthcare professionals are trained, skilled and confident in recommending and inserting IUDs. We've got 1 in 5 Australian women will have menopausal symptoms severe enough to interfere with their daily life. I know a number of my colleagues have spoken about either themselves or women that they've known who've had to the extreme end of having to give up work. That is shocking for our economic productivity as a nation, not to mention just the extreme impacts that has on women forced out of the workforce way too early. The government will also provide funding for health professionals to undertake additional training in menopause and perimenopause, develop the first ever national clinical guidelines. That's an important step. After more than 20 years, 3 new menopausal hormone therapies will be listed on the PBS. Again, from March the 1st, estrogel and a number of others now will go onto the PBS listing, help secure supply and end that shortage of these really important treatments. Around 150,000 women each year are expected to benefit, who otherwise might pay between $400 and $670 a year. They'll start seeing a maximum of $31.60 a month, or only $7.70 if you're on a concession card. Women on these therapies look like they'll be saving $290 odd. But it's much more than the financial gain. It's going to give women a whole new level of confidence and well-being, and that's what is especially important. I just want to end in the brief time that I have left to say that this historic boost to women's health, it will deliver that important matter of choice, help lower costs and make healthcare for women a much more affordable option. I am very, very proud to be part of a government moving this. I'm very proud to be hosting the Assistant Minister, Jed Carney, who will be conducting a Newcastle Women's Health Forum on Thursday, the 20th of Feb. I invite all Novocastrian women to join us in this important historic moment.